Good afternoon. My name is Dominic Upton and I'm from Charles Darwin University in Australia. This afternoon, I'm going to be talking about the psychological consequences or the psychosocial consequences of living with lymphedema. I'm starting from the diagnosis and going all the way through management and treatment, stigma and the social consequences. So if we start with the diagnosis, we've got to remember that when a person gets given a diagnosis of lymphedema, it's not just a medical condition. It comes with a whole host of psychosocial consequences. And it's important to find out what these mean to the individual. How does the patient define their condition? How does it impact upon them economically, psychologically, socially, whether that be through family, friends, or organised groups? All of these come with a certain amount of uncertainty, and I think it's important that the medical or nursing professional appreciates these. Although a medical, nursing, podiatry, a physiotherapist, or other allied health profession may know some of the medical consequences of the conditions, they don't understand how it can impact upon an individual personally. The individual with the condition may be uncertain about the diagnosis, the term, what the actual symptoms mean, what the long-term prognosis is, how the treatment is going to impact upon their daily life, how the management of that occurs. Similarly, there might be what's known as trajectory uncertainty, the course of the condition and the outcome, whether it's going to be successfully treated or not. And symptomatic uncertainty, these short-term fluctuations are going to impact upon the individual. It's also important to realise or to appreciate that an individual patient or person living with the condition may experience stigma. And this stigma can come in one of two forms. It can be enacted stigma. This is a negative comments or discrimination from others, looking, pointing, making comments behind a person's back. Or it could be felt stigma. There may not be these negative comments or observations from others, but there might be a perception that there is. They may be feeling negative or negative consequence of this. So we have to ask the individual how much stigma they feel, how much they've experienced, and how we can actually introduce a sort of coping, a support mechanism for them. Now, coping is an important psychological resource. Some individuals may come with an abundance of coping resource, the psychological strength, the hardy personality, the one that really just says, well, I'm just going to crack on with life and get on with it. Or there may be others that don't know how to cope at all. For the first, you're going to need to support them, gently nudge them in the right direction. For the latter, you're going to provide a great deal of individual support and guidance. One of the best forms of support that I can think of, and an added sort of coping resource, is social support. This is the emotional, practical support that you can gain from others. Those others can be family, friends, colleagues, medical and nursing professionals, or organised groups and collectives, churches, self-help groups and the like, for example. Obviously, an individual is not just there in their own rights. They come with a whole range of family relations or networks. Any condition can produce an emotional, practical strain on relationships and on others within that network. That can sort of, because these family relations can be seen as sort of a system, then what happens is that the negative impact can impact on the member of the family. That negative consequence can therefore impact upon the patient, and this vicious circle continues, leading to an isolation of the whole family and the isolation of the whole unit. Medical professionals have to be aware of that. And I think all of this consequently can lead to a redefinition of the self. What does that person feel like? What do they view themselves as? Do they view themselves as a normal person, to use that term? Do they see themselves as a valued individual? How do they define themselves with this new condition? They've got to learn to manage their own symptoms. They've got to learn to manage their treatment. They may have to reorganise their wardrobe, their social connections, their whole daily life. All of these things can lead to a reconstitution of the self. So in psychological terms, this would be biographical work. Again, the individual medical or nursing professional has to be aware of this and has to provide support, whether that be coping, social support, or indeed information. So that information needs to be education about the condition, so proper medical information, but it also needs to be about the psychosocial consequences, how it can impact upon the individual and how the individual can actually learn to live with that and how they can go forward. So if we put all of this into practice, we need to ensure that there's support and education at each stage of the patient journey, from diagnosis through to successful treatment and management. We need to provide prognosis, information and education over prognosis and treatment, ensuring that an individual knows that there's going to be issues with uncertainty, that there'll be fluctuations. We're going to have to provide support for mobility, pain and medical treatments. We're going to need to provide support and direction for coping, and that can include social support, where best to get that from. All the other psychological issues need to be dealt with: body image, stigma, anxiety, and so on. Now, anxiety and depression are a key, or can be a key feature for certain individuals, as a consequence of any medical diagnosis, but that can be particularly important in lymphedema. So the medical and nursing professional should be aware of high levels of anxiety or depression and refer on wherever necessary. However, importantly, an individual's psychological factors can be really protective, and so it's important that the nurse, the medic, the allied health profession really builds upon those and helps the individual to support themselves. I hope you found this useful, and I hope you can relate this to some of the individual case studies that you've seen. I thank you, and good evening from Australia.